Good morning, everyone, and welcome to the CSPDM series webinar, Practical Support for Accommodating Workers with Chronic and Episodic Disability. My name is Diana St. Pierre, and I am one of the board members of the CSPDM. In this webinar, you'll learn about the award-winning and evidence-based job demands and accommodation planning tool, and how it can support workers and organizations to identify practical work-related support strategies and accommodation ideas for workers with chronic conditions and disabilities. Developed through the Accommodating and Communicating About Episodic Disabilities partnership, the JDAPT has two versions, one to be used by workers and one by organizations to support people with disabilities. There will be time for questions following the presentation. Please write your questions in the Q&A section at the bottom of your screen. And we also did see a few messages come in already. The presentation will be shared afterwards, and you will get one CEC for attending the webinar. And so I'm very happy to introduce Dr. Monique Gignac. Dr. Gignac is the Scientific Director and Senior Scientist at the Institute for Work and Health and Director of the ACED Partnership. She's also a professor at the University of Toronto's Dalla Lana School of Public Health. Her research expertise is in the areas of health and social psychology, including health models of disability. Of particular interest is research on workplace communication, privacy, support, and accommodation needs among individuals living with chronic episodic conditions. Without further ado, I will pass the mic over to Dr. Gignac.
Thanks very much, Diana, and thank you everyone for giving me the opportunity to be here, either this morning, this afternoon, depending on where you are right now in the country. As Diana mentioned, I'm going to talk a little bit about the job demands and accommodation planning tool. And oops, I'm just seeing, there we go. This is actually part of a very large partnership research grant, and we call ourselves ACED because our focus is on accommodating and communicating about episodic disabilities. And our aim is really to try to contribute to ways to support the sustained employment of people who are living with intermittent chronic health conditions. So you can see here a lot of names. We have a really wide range of researchers who are on the team with a lot of different expertise. We have occupational therapists, physical therapists, psychologists, occupational physicians, ergonomists, epidemiologists, a whole wide range of different individuals. We also have a number of partners who have worked with us, organizations who from the outset have been a part of this research, and they include the Institute for Work and Health, where I'm housed and where a lot of the researchers are based, but also a number of health charities and different groups who are part of the research. And we have a group of expert advisory folks who are people with lived experience of different types of health conditions. We've had people with lived experience participate throughout the research, but this group has provided a lot of time and effort to particularly help us with some of the communication pieces. The funding for this research has come primarily from two of Canada's federal granting agencies, the Social Sciences and Humanities Research Council of Canada and the Canadian Institutes of Health Research. But we did receive some initial seed funding for the development phase of the JDAPT from Canada Life. We've received some money from Mars. I'll talk about that in a moment. And also a little bit from Employment and Social Development Canada. So I thought I would start actually with some of the takeaway messages I have, just to kind of give you a sense of where I'm going with all of this presentation today. So I think some of the bottom lines, and I don't know that any of this is going to be a surprise to you. I know you will be familiar with the fact that people living with chronic disabling conditions are really often unsure whether or how to communicate their workplace support needs. We hear from workers and disability managers and other groups in organizations or who work with organizations that often they need more information about the types of support that might help meet job demands and help people sustain their employment or return to work. So we've created an evidence-based tool, the Job Demands and Accommodation Planning Tool, or JDAPT for short, where we're trying to provide some concrete support and accommodation ideas. So I'll tell you about the tool. And some of our early evaluation efforts are quite positive in terms of usability, its comprehensiveness, relevance, and some of the outcomes. And this is an ongoing part of what we're doing. So if I back up now, I'll just first start with what do we mean by an episodic or a dynamic disability? These are really terms that are fairly new. We may not land on these as the final terms here, but you're hearing more and more people talk about episodic or dynamic disabilities in Canada. And to put this in context, Statistics Canada tells us that about 6.2 million Canadians who are 15 years or older live with a disability. So some limitation in an activity that might be related to health or some other condition that they are living with. Over 60% of those disabilities are considered episodic or dynamic in nature. So what we mean by that is they're intermittent in some way. So people will have sometimes periods of a month or more where they have no limitations or few limitations, sometimes years, and then a disability may reoccur. There may be a flare or an episode, a recurrence of a difficulty. Sometimes these are progressive. So again, people may have periods of time where there are few limitations, but over time, symptoms or the impact of a condition seems to be getting worse. And then other times for people, they tell us that there's really no pattern, that they fluctuate quite wildly. In addition to being intermittent, many episodic conditions are also unpredictable and invisible to others. And so what we mean by that is that even when people are doing everything they should, they're following treatment guidelines, they can still experience episodes or flares. A medication, for example, may stop working, or there may be some change to what they need to do, and that may create a period of more disability. And often others aren't aware. If a person doesn't disclose information that someone's living with a condition that creates challenges. There may be signs or symptoms that something has changed or doesn't seem quite right, but people may not know what that's about. So I put down a bunch of examples on this slide that include a number of mental health conditions as well as physical health conditions. There are many more that could be added here to this list. I've put long COVID down. We don't have a lot of information yet about long COVID, but the data that are coming in suggest that it may also be somewhat episodic. So this kind of changing, unpredictable, and invisible nature of many disabilities creates challenges, of course, as many of you know, in workplaces related to disability communication, disclosure, and the protection of privacy. People just don't know how to deal with that if they're living with these conditions, and in providing support or accommodations to maintain productivity. And so this is the area where this particular grant is focused. We're trying to improve this communication support process for people who are living with episodic disabilities and enhance, again, their ability to sustain employment. If I were to put this in a very simple diagram that's trying to capture something that is actually very complex, I would maybe just say that a worker has a problem or a support need. They ask themselves, should I say something and what can I do? And so we've been working on two different tools. One is a communication decision support tool known as Decide, and we haven't got that up and running yet. We've got a lot of data, and we're hoping to have this out early in the new year. And the second tool that I'm going to talk about today is the Job Demands and Accommodation Planning tool. But before I tell you about the tool itself, I just want to give you a little bit of sort of some of the context in the research that we have related to communication. So across 5 different Canadian surveys, and why the Canadian surveys are important is because, as you know, different countries will have different legislation around communication and disclosure. So in Canada, in some surveys with about 3,400 people, anywhere from about a quarter to nearly half of participants in the studies will tell us that they have not shared any information about their health limitations at work with their supervisor. even fewer people will have disclosed to HR or a disability manager or a union representative. And you get usually somewhat more people will share some information with a trusted colleague, but usually not all of their colleagues. There's no single correct decision around communication. It varies related to a lot of different factors, and I'm happy to talk about some of those. But we hear for people who disclose sometimes positive outcomes, that they did get that support, they got that greater understanding. But we also sometimes hear that they feel they have to prove themselves all the time. People are watching. There can be stigma and gossip, a loss of reputation as a good worker. Deciding not to disclose, well, maybe that will be positive as well. You may have less stress, maybe less concern about how others view you. But we do hear about, obviously, then you may not get the support that you need. And often we hear about misperceptions about the reasons for any job difficulties. We hear this especially with people who have pain, chronic pain or mental health conditions, that sometimes I guess it's like symptoms leak. People notice something's up, something's changed with you. And so because they don't know what's going on, they don't know you're living with a health condition, they may misattribute what's going on to the fact that, oh, maybe this isn't a good worker. Maybe they lack skills. They're not motivated. They're moody. They don't get along with others. So you can have these misperceptions. And so again, we hear positive and negative outcomes. We've been doing a lot of work to understand what goes into making decisions. And so this is just a little bit from one of our surveys. It had 737 individuals, all of whom were living with either a chronic physical or mental health kind of cognitive condition, and many individuals had both. We asked a lot of different questions about communication. So we asked different questions about needs. So for example, are you experiencing changes to your health or your job demands? Are you worried about your job in the future? Do you need support? Are there safety concerns right now with your job? We also asked people about their goals. Why would you maybe think about disclosing or not? What is it you're trying to achieve? And do you think sharing information might be helpful? We asked people a number of questions about their own personal preferences and values, because we know people have different ideas about whether they should share or whether they value privacy, they want to control information, and what their past experiences have been. And finally, we also asked people about their organization. So what's available to you in the way of support, things like benefits and sick days. Are you using accommodations right now? We also asked, though, their perceptions of their workplace culture in terms of whether or not they think their coworkers and others are supportive. So in terms of what we see, just sort of generally to sort of lay some groundwork, in this particular sample, about 56% of our respondents said they had considerable needs for support. So they answered a number of the needs questions that something was going on where support would be helpful. Their health was changing, something was going on at work, or they were concerned about the future and they thought they could use support. We also heard from people that if they needed accommodation and information needs, if that was a goal, sharing was seen as helpful. And then about 70% of people, which in this sample was higher than we may have thought, said that they did have some supports available to them in their organization. And Diana, I think you're not muted, just to let you know. Yeah, that's okay, just so you know. So about 70% of organizations or the sample said their organization actually had a fair bit of support available, which was good to hear. So if we look at this, it looks like, okay, there is a foundation, a suggestion that we have people with needs, that they might feel that sharing is okay, and that their organizations might provide them with support. But if we add to that some of the other information we hear, things get complex very quickly. So although accommodation needs and information needs, it would be helpful to share that, those were not the top goals people told us about. The top goals were actually around preserving financial security, protecting one's reputation, and improving well-being. And for those, I need the money, I don't want others to think badly of me, people felt mostly that sharing was not helpful of these goals. We also had a lot of variability around personal preferences, with 30% of respondents said they thought they would be willing to share and that was important. But 36% said they were reluctant to share, and another third said they were really unsure about sharing. They could see some positive benefits. Maybe it had gone okay in the past, maybe it hadn't, but they had some concerns. We also found that although organizations had a lot of supports and people recognized that, only 20% of our respondents reported having a positive culture. Another nearly a quarter of participants were really unsure. They worked with some good colleagues, they trusted some people, but they didn't trust everyone. They were concerned about gossip or what this would mean for their career. And a full 57% of people in this particular study said they didn't think they had a culture right now that was conducive to sharing. So you can see with all of this, I hope you're as confused as I am and you're having trouble remembering it all, because it really shows you how hard it is for people to kind of go through this process and make a decision. And so that's why we've been working on a decision support tool, but we also wanted to give people a way to start thinking about their needs, their support needs. But before I talk about that, I just want to give you some of the organizational perspectives that we've had in some of our studies. So we did some research, and this was now not a big study, it was a smaller qualitative study where we did in-depth interviews with different groups. And the groups were people who provided support to individuals with disabilities. What are the key challenges to providing support for these individuals? So there were 27 individuals, again, all interviewed at length. You can see here in the graph on the far right there that on average, these were people with a lot of experience. So on average, 19.5 years in their profession, not necessarily with the same organization, but had been doing this work for a while. We had, as you can see right at the top there, we had 7 disability managers, but we also had human resource professionals, managers, supervisors. We had some union representatives. We had 3 labor lawyers, a labor lawyer for workers, 1 for organizations and 1 for unions. Some of these individuals own small businesses, and so they had to wear multiple hats and so on. 5 of them themselves lived with an episodic condition, and they came from a range of sectors or supported different sectors. So there were multiple themes that came up in the research. And so I think there were 7. There were 2 overarching themes. There were about 3 themes that came up around communicating, and another couple of themes that came up when people chose not to communicate. So I'm not going to go through all those themes, but I want to just give you a little bit of a taste of what we heard from one sort of piece of the overarching, a little bit about the communication and a little bit about the decision not to communicate. So one of the things that came through was the different cultures that a workplace has, and that often people aren't aware of all the different cultures that different places have. But the cultures that kind of came up most commonly were of 2 types. Most common was a kind of a medical model, and that was our team's words, not the words that we heard from people. And this was really where there was a sense that health information really needs to be validated, and it needs to be really closely monitored. And so often these were larger organizations, many times where they had work injuries were fairly common. And so they used this medical model, the same kind of model they use for injuries for people who were living with chronic conditions. But some organizations were moving away from this. And so they had what I would call more of a biopsychosocial model, in that they recognized that the disability was not all on the shoulders of the person. It was not all about a diagnosis. Disability arises because of physical and social environments as well, which is the way the World Health Organization defines a disability. And the reason sometimes they were moving to more of these models was that often health professionals were not able to provide the kind of relevant information that an organization said it needed. They just weren't familiar with a job. Workers Also, we're not able to get timely or appropriate access to specialist care. So where an organization wanted sometimes a note from a relevant physician, workers were saying, you know, I'm on a list to see someone, but I won't be able to see them for 9 months or a year. And that's just waiting too long. And then some workers we were hearing from organizations were really concerned about providing information because depending on who the note was coming from, they were feeling they would be outed. So if you have a note from a psychiatrist or an oncologist or a rheumatologist, it's already revealing some information that maybe people wanted to keep private. So they were moving more to these different models. And everybody thought their model was great. And we don't know if some are better, but here are some of the comments that we heard. First, about the medical model, someone in support of this, because our third-party providers have that diagnosis. In most cases, it's a much smoother transition. Return to work recommendations are more meaningful. The most important thing is that people are properly diagnosed. Interestingly, an occupational physician provided us with the next quote, which disagreed. 75% of cases do not involve a medical practitioner at all for up to 6 months, up till they go to long-term disability. We're trying to accommodate people as opposed to manage their diagnosis, which is a complete and utter waste of time. You can't explain everything by medicine, by diagnosis, and you need to find some way to be fleet of foot and manage these, because if you don't, they go sour very quickly. So culture is something to consider in any, as you know, in any implementation of disability management policies. A second thing we heard that was coming up was these misgivings that people had about others who were providing workplace support. So everyone in the study acknowledged the important roles that others were playing in the support process. But the comments frequently included a lot of concerns about other skills and training and motivation and involvement. And what do we do about this? So just, I think supervisors took the biggest hit, with people saying things like they just don't have any sort of broad basis of knowledge upon which to base things. So they are often colored by stereotypes or predispositions and unknown discriminatory attitudes. Not all the comments were negative, but there was just seen a lot of variability among supervisors because they don't have the training. Comments about physicians. The physician role is really to diagnose and treat, and we need to stop asking them if a person can do their job. They are very intelligent people, but they do not have the time to understand the workplace. Comments about human resources. I did find that the turnover in that group was quite high. Even mid-process, I was dealing with one person, then all of a sudden it suddenly moved on. That continuity just organizationally was a challenge. We also heard from workers that they often have concerns about going to HR because they feel that HR works for the organization, not for them. So lots of misgivings that people had about others. And then the final theme that I'll just mention that we heard from organizations was when someone doesn't disclose. So in larger organizations, as you are all, I'm sure, aware, formal communication can be triggered by a threshold of work absences. So people are away a certain number of days, and now they find themselves in an attendance management or an attendance support program where they have mandated a meeting with HR and a supervisor or others. And workers and workplaces acknowledge that these really pressure workers into saying something when they may not be ready or prepared or know what to say. It tends to recast disability now as a performance problem. So now we're talking about progressive disciplinary actions. Future discussions also then tend to revolve around these performance deficits and not on providing support or the skills and the abilities. It tends to erode trust and confidence in the process very quickly. And some workplaces said they even had experiences where they were quite sure that a worker was living with a mental health condition, but that worker would rather take a hit in their performance than disclose that they were living with a mental health condition. And so, things continued, and then sometimes they escalated, and then maybe someone would disclose. And there was this sense of, is this real? Are they just trying to do a last minute attempt to save their job? And so it just got very messy and negative. So a couple of quotes here. It sets up an urgency at the beginning because usually by the time they might involve a disability manager, they're quite high in the attendance management program. The employee in a lot of situations is not getting along all that well with management because they're being attendance managed. And then union representative, too often where we find out as a representative of the worker, it's because they're in a position of discipline. So with that kind of a bit of background about what we're hearing from workers and what we're hearing from workplaces, some of the bottom lines for us are that, workers are really wanting guidance on whether to communicate, how to get support if they don't want to share information, and what they can share. So help us out. Workplace professionals are looking for a kind of a transparent, a consistent, and a comprehensive approach to assessing what are really very individualized worker needs. So an acknowledgement that you have to do case by case, but at the same time wanting a process that everybody understands. And of course, everybody can always use support and accommodation ideas. So that's where some of the impetus arose for this JDAPT tool. What we were wanting to do was create something that would be easily accessed by people, that would be personalized, not just a list of do's and don'ts, something that would be interactive, a person can work through and focus on their own needs, and of course, use as existing evidence. Very often we hear from people, they don't say anything and then there's a crisis. So we were wanting to try to see if there would be a way we could contribute to more of a disability prevention and support framework rather than this crisis management approach. We know that you can't have something that will cover every job type, every type of condition and all needs. So we wanted to create something that would provide a lot of examples, but would still maybe promote discussion and brainstorming. It would emphasize that there still are skills and abilities here. That's not all performance deficits, would improve the outcomes of a process, and something that would protect privacy, since this just keeps coming up over and over again for us. So what the job demands and accommodation planning tool does is it starts to focus on work demands that may be challenging at times or regularly. It doesn't focus on the health or the disability diagnosis. We actually did a big environmental scan of what's available out there in different tools. There are a lot of great tools out there. It wouldn't occur to someone with lupus that they could maybe find some great information on a cancer website or a mental health website in Australia. And so we wanted to move away from this health diagnosis, as I said, and sort of focus on the job demand. The JDAPT guides someone through a series of questions about their job tasks and their working conditions. And then based on where they're saying they have challenges, they're provided with some ideas about dealing with that particular job demand. And we hope, again, that that will help to generate solutions or additional thinking about what might be done that's relevant to the job. And a person can keep it for themselves, or they can share it with others and focus on work solutions. We actually entered the JDAPT prototype into a competition that was run by Mars, which is a venture capital organization, and CIBC. They did an inclusive design support challenge in 2022. And the JDAPT actually was the grand prize winner, which was terrific. But we do want to keep making it better. And so that's what we're trying to do. I want to just, before I tell you more about the tool, tell you a little bit about what it is not. So it's not providing medical or treatment advice. Obviously, we're going to just stay well out of that, and we're not providing legal advice as part of this tool. This is really meant to be a tool in a broader toolkit. It's not meant to replace anybody's job. It's really to kind of, provide a starting place for people to go forward. We try with the tool to provide concrete examples of supports, but not be overly prescriptive. So it doesn't say you must do this or you should do that. That again is for you and other professions to work through. We would hate someone to say that they use the tool and they told their employer that I must have this or I should do this, and then their employer says, well, that's an undue hardship, and so I'm sorry, you're out. So we don't want to go there. We don't provide sort of general lifestyle advice or a lot of things outside of work, cook large meals and portion them up so you have more energy at the end of the day. We don't do that. We do provide some, suggestions around exercise or, sleep, or getting more information from a professional that's related to particular job demands. But really, we wanted to focus on workplace supports so that the burden isn't all on the worker, but that there are things that workplaces can do as well. And the supports have a link to a specific job demand. There are other strategies that might be wonderful for a person, like joining an employee support group, but that's often not linked directly to what a person's specific job demands are. So we've tried to do that with the tool. So I put the link up here, and it'll be on other slides as well. Just for, apparently we got lucky with JDAPT. If you type JDAPT in, it's an acronym not used by a lot of others, so it will come up there. And in fact, you can type in job accommodation tool into Google, and I think the JDAPT comes up as well. But this is the link to it. People are asked about 24 different job demands, and they're organized into 4 domains. So they're asked about some physical demands of work. They're asked about some cognitive or thinking demands of their job, some questions about working with others, and some questions about their working conditions. And there are different versions of the tool. So there's a worker version that allows someone living with a condition to self-assess what their job and their needs are. So they fill that out. And that is available now. We also have 2 organizational versions. So one of them is allows someone in an organization, like a disability manager who has a worker in mind, to go through on their own or with a worker different job demands, and think about that person's needs specifically. We have this other kind of stripped down version that is just thinking about the job, not thinking about a worker at all. And that's because we were hearing from organizations that they would like to make the workplace often more inclusive and accessible. And so sometimes they hadn't hired anyone, but they were thinking about what they could do, or in general, what would we be able to do with this job? And so there you can fill it out, just thinking about work generally. The worker version has English and French available. The organizational version, the English versions are up, and we're hoping by the first week of October, we will have the French versions up for those versions as well. They're just being now programmed into the computer. So we've done the translations. They took a little longer because we were also very conscious of trying to use more accessible language. And with the masculine, feminine pronouns in French, we wanted to try to get around some of that in the ways that we talked about different supports and the questions. So for each of those 24 different job demands, a person is first asked, is this an important part of your job? If you say no, you get moved to the next question. If you say yes, then the person is asked, is this difficult? If it's a worker, due to your health. If it's a supervisor or a disability manager, does it seem to be difficult for the worker? And you don't get asked about the attribution, and I can answer why later. And then the person is also asked, does it change over time? So maybe it's fine now, but sometimes it's worse than other, or maybe it's bad now, but sometimes it's better. Depending on what you say, you get a report. And where there are challenges, you're linked to these different support strategies and accommodations, and an individual can save the materials, and they can also tailor them to themselves. So what you will see, this is just a screenshot of one of the introductory pages of the JDAPT with the big domains there. Won't go through all of this. These are actually 2 screenshots. And I'm not going to go through it all, but on the left, you can see a big 16 of 24. This fictitious person who's completing the JDAPT has said that of the 24 job domains, 16 of them are relevant to them. And then they give a bit of a breakdown of how many of the physical versus cognitive and so on they answered. Of the 16, if you move to the right now, you'll see 8 of 16. This fictitious person has said that 8 of those 16 are challenging for them. They're difficult at least some of the time, and sometimes all of the time. And 7 of the 16 are changing. They're not constantly difficult or easy. And so the individual would get then accommodation ideas for those demands that are at least sometimes difficult for them. And this is not the way it looks, but just to give you an example of the kinds of supports. On the far left, you can see physical endurance or stamina. So if you said that's an important part of my job and it is difficult some of the time, there are lists of different accommodations, and we have them kind of organized in things you might try on your own, often outside of work. Adjustments you might try at work, maybe they are things you can do on your own without permission, or maybe you might need some permission. And then more formal accommodations to consider requesting. For all of them, you can look at them and they will open up into some examples, some concrete examples, just to give you an idea of, what we're kind of thinking of here, again, to help with that brainstorming. And you can click on any of them that you think are even more relevant for you. So if some of these wouldn't be possible, if work at home came up, for example, and that's just not something you could do, you can click on other demands and create a personalized list. So this slide now has concentrating for long periods of time. Now a person gets very different kinds of ideas and suggestions. Again, they open up, and working with others, again, same kind of thing. There are some repeated strategies where they are relevant, and a person, if they're seeing them multiple times, again, can personalize the list for themselves. So that's a little bit about the tool. Just to finish this morning, we have been doing some evaluation. It's all, driven by the theory. We've had researchers, people with lived experiences, and our partners involved all the way through in the development and the evaluation. We also recognize that this tool, again, it's going to be part of a system. It's that we'll have limited control over. It's not something that we will be able to really control how it's used necessarily, but we do certainly make comments about how we don't want it to be used. In doing evaluations, we've tried to get a lot of contextual information that we'll be looking at to understand, for whom is this working well, and maybe where could we do a better job. So we haven't used randomized controlled trial methods for this because we can't blind people to what condition they're in. There's no gold standard here to compare to. So we've used different methods, including pre-post and follow-up. So we, just in terms of what we've done, we did a lot of needs assessment. I described some of our research work, and we've done some environmental scans. We've done what's called formative evaluation. I'll tell you a little bit about that in a minute. It's sometimes called sensibility testing or cognitive debriefing. We've done some preliminary outcome effectiveness, and we will be doing more implementation evaluation as we move forward, used a lot of different methods. So in terms of some of that initial formative evaluation, sometimes called sensibility testing, we did a study where, again, very in-depth, very labor-intensive to do this work, where we sat down with different people and we went through every single question. And we asked about its comprehensiveness. Do you understand it? Does it seem relevant for people? Is it feasible for people to even answer this? We wanted, as a goal, that 70% of the participants would say, yes, this is comprehensive. After going through all the questions, yes, I think it's relevant. In terms of who was in the study, because again, it takes so much time, we had 46 workers living with different physical and mental health conditions, 23 organizational representatives, including disability managers, lots of different variety of the types of sectors. And for most of the questions, the sensibility assessments exceeded 70%. In terms of comprehensiveness, it was close, but we actually added 3 new items. We added an item about working in locations with no easy access to facilities to meet needs. And so that's like a kiosk in a mall where maybe there's no refrigerator or private bathroom, or having to travel around as part of your job. Again, no access to maybe facilities for a rest or something like that. We also added a work demand around having to participate in social activities or that had social expectations, and work that relied heavily on one or more senses. So a tailor or seamstress who uses a sense of touch, a chef who has a sense of smell and taste as an important part of their job. We heard things like, it seemed that you covered every piece, whether it was the physical piece, tedious work that's happening over and over again, or working long hours and traveling. So you have covered everything. And that was a baker with ADHD and a skin condition. There were basically all of them that I go through in my job. It's basically everything I do at work. That was a truck driver with Crohn's disease. I go in and say, I'm dealing with a mental illness, and my boss says, what do you need? And I say, I don't know. I think the JDAPT might be better to help me understand actually these three aspects of the job are what are actually difficult for me. So let's think about what we do with those. And as you can imagine, I chose those three quotes because very different jobs, very different conditions. So that was very positive in terms of our initial work. We've also now been turning to some outcome effectiveness. So this is ongoing. We just finished collecting the Time 3 data at the end of August. And so that's a 9-month follow-up. So we interviewed people about their job, lots of information about that and their health. We then asked them to fill out the JDAPT and got their initial perceptions. We went back to them 3 months later, asked them, have you used it? What do you think about it? And got some more job information. And then 6 months after that, or 9 months from the beginning of the study, we did the same thing. We went back. Are you still using some of these? What's going on here? We started with 269 people, and we've been able to keep in 188, which is about 70%, which is terrific, because a lot of interventions, you'll have less than 50% of people over time. So that's been helpful for us. Some early findings. Most people in the study, about 72%, said they had made some changes. They were using the JDAPT. This is at 3 months because I don't have the 9-month yet. They had made some changes to work. So someone, for example, commented it was empowering to see how much one can do on one's own, especially when I'm hesitant about being supported by HR. And this disclosure piece is going to explain all of these findings. We had about 58, nearly 59% of people said they had made some changes at work, which was terrific. I used both the full and my personalized list of strategies and accommodations when I was informed that I would need to return to working in the office some days a week. The suggestions in the materials were very helpful. And now only about 1 in 5, 21% of people said they had shared the JDAPT with others. What are the big reasons for that, for why people aren't making changes at work and why they aren't sharing? The number one reason is everything's fine right now. Again, the episodic nature means sometimes things are good. The second reason was I don't want to share information. So that disclosure piece is still an issue. But we did hear from people who had shared. I used the list of strategies and accommodation plans, plus the language of the job demand summary to help me request a workplace accommodations plan. These tools were critical in helping me explain how my disability impacts my work and allowed me to think about possible solutions. The plan is still being finalized. Without the JDAPT, I wouldn't have had the confidence to go through this intimidating, that's their words, process and advocate for myself in such an effective way. We did get a lot of positive comments. Some people, haven't, found what exactly I'm looking for depending on their job, but mostly overwhelmingly, there were positive comments. We've also, just to finish up here, looked at some changes over time. So before they ever saw the JDAPT, we asked people about their confidence. That's what self-efficacy is really tapping into. What's your confidence in problem solving, what you're dealing with related to your health and work? What's your confidence that you can meet your job demands? And there were several questions about each of these. And what's your confidence in meeting your emotional needs, dealing with stress, dealing with your worries about the future? We also asked about difficulty getting as much work done as others expect and work productivity problems. What we see are changes from the initial to the 3-month that are all quite positive and all highly significant. So statistically, these are significant at 0.001, unlikely to be chance. So people had more confidence in solving problems, meeting job demands, and meeting their emotional demands after using the JDAPT. They reported fewer problems getting as much work done and fewer work productivity problems. Now you can have something be statistically significant and it might, so it's maybe real, but it may not be that big. So we also looked at something that's called an effect size, and it tries to gauge just how meaningful the change is. If you have a number around 0.2, it's saying, okay, this may be real, but it's small. Maybe we won't see it. A number around 0.5 is moderate. It's something more we'll notice. And 0.8 is quite large. So we were very pleased to see in some of the initial findings that we were getting moderate to even a large effect size in terms of some of the self-efficacy. So we're continuing to do analyses. I'm sorry, I don't have the 9-month data yet. We're going to look a lot at, again, who is this working for and who it isn't. Some early findings suggest it was working as well for men as it was for women. It was working as well for people with physical as mental health conditions. Seem to be getting a lot of very positive responses from younger workers and contract workers. I think they have fewer opportunities or experiences around this. So the tool seemed to be very helpful for them. So we'll do more research and also look at adoption and reach and accessibility. And always looking for new ways to enhance the list of ideas around accommodations. So as I mentioned, the English and French versions are freely available for the worker. They're freely available for everything. What we have the English up for all of the versions. The French will be up for the organizational versions very soon. We do not ask for any personal identifying information. People can save their responses, but we don't save anything to protect privacy. It's only been available for since April 1st, the worker version. And so in that first kind of 5.5 months, we are pleased that we have so far over 6,200 unique visitors. We've had the PDFs downloaded by over 1,700 unique visitors, most from Canada, where we've been trying to do a lot of work and we'll do more, but we've had over 1,000 from the US, UK, Australia, and a number from a number of other countries as well. So I will stop there for questions and comments that you may have, and I'll turn it back to you, Diana.
Thank you so much. There's been a lot of positive comments in the chat, lots of expressions of this being an amazing tool. There was a question about whether there is still a plan. This was an early on question, whether there was still a plan for an employer-focused version, which you have answered. That was the only question that came in. So if there's other questions that anybody has, they can type it into the Q&A. And but I think overall, just a very positive response to the tool.
Well, thank you. And I really appreciate it. It's been terrific to have disability managers included in the development and in the evaluation. And so please do feel free to also to reach out to me and the team, and would love to, work with you to kind of have this tool be used and improve the tool going forward. Just to kind of let you know some of where we're thinking, and thank you for all the thumbs up, and I really appreciate it. Thank you. There's thousands of hours that many, many people put into it, and it really means a lot to us. We just want people to use it. But, going forward, it might be helpful, for us to either enhance the tool with some more job-specific demands, or create, do we need to create a JDAPT for healthcare workers? Do we need to create a JDAPT for minors? It takes a lot of time and effort, but we are thinking of those things. We're also right now trying to get a proposal in to look more at, for example, long COVID. Is this different, or are there some different kinds of supports? So we want to, this is, I guess, the beginning of the end, to kind of requote someone. It's not, or it's the end of the beginning. I kind of think there's a lot more to do, I guess, is the bottom line.
Yeah. And something that I see this being really valuable for is maybe more so for larger organizations that are dealing with long-term accommodations, but having this as a complement to that long-term accommodation process, then that can help with the discussion around the needs of the worker and the organization as well. There was another question that came in. Any interest in tool expressed by federal government and its various departments?
Yes, thank you. That's not a planned question, but that's great. We've been talking with 3 different departments so far who are interested, and I won't name them because we are still talking with them. So they are waiting for the French version to come up, obviously, but they include, without giving away too much, they include the departments that are responsible for training supervisors and managers. We've had some conversations with them about this perhaps being included as part of that to get at some of those concerns, again, that people have about the variability and skills of managers and supervisors. Also speaking with a department whose role includes basically implementing the Accessible Canada Act so that the federal government walks the talk. So they are interested. And then another very large department is also interested. And so, you know, they've told us that, not surprisingly, as we all know, governments move very slowly. So they have a lot of things they want to know, and particularly issues about privacy and protecting privacy. Again, like the website is protected. We won't give the programming to someone else because we don't want them to mess it up. And we don't want somebody to get access to somebody else's data. So we'll have those conversations, and we're very hopeful that it could be used by the federal government. And we would like to also talk with some provincial governments. I guess I would love to know that, you know, whether or not there's a way for it to be available on your website, and others who, you know, aren't maybe here, but, you know, would like to know more about it, you know, could link to it. So I don't know if your society provides that, and I don't expect you to answer it right now, but if there are opportunities to share it, that would be terrific.
Okay. There was another question. Has there been any feedback from employers with concerns of employees coming forward with recommendations that the employer was unable to accommodate?
I think that we haven't heard a lot of those. We have had some conversations with industry, with a couple of different large organizations. They haven't told us that that's an issue. Every once in a while, we get emails, you know, I would like to say this, that I need this. And so we've been really pushing back very firmly that this tool is not prescriptive. You should not use this in any way to try to provide a legal case for something, and that without others being involved in the process, we cannot determine whether something would create a hardship for in our organization. And so it doesn't seem to be on people's a big problem. Another comment that did come back that I'll just mention now is, are we concerned about abuse in the hiring process? That someone might use this to screen out people who have limitations. And this came up at another conference with some legal folks there, and they felt, no, there shouldn't be a concern. First of all, it should not be used for that, but that it's likely not to be in any way typically seen as something that could be used for that.
Okay. And there was a comment in the chat. Will an email be sent out to participants today confirming participation in the webinar? Lanny, do you have a comment on that?
Yes, I do. And automatically, sorry, you will receive a notification it'll come from Zoom confirming your participation in this. So keep an eye out in your email or junk mail, but you receive the invite. It should come from there as well.
Okay, thanks. And another comment in the chat, just to confirm, are we able to share this presentation with professional committees such as the Ontario Association of School Business Officials, Ontario DM Committee?
Yes, happy to have people share the website and this presentation. I think I may have made 1 or 2 minor changes since I sent it to you, Diana, so I will send you the copy I used today at the end of the
Okay.
talk that can be distributed.
Okay. And so to answer those other questions, yes, a copy of the presentation will be provided. Also, can you provide any examples of how some current adopters, employers, organizations are using this as a tool and part of a greater accommodation process?
So I will, because I don't have the permission of the folks, I won't say who they are, but I will say one of a large university has been using the tool and gave us an example of they used it with, and this is staff, not so much students. That's another potential adoption of the JDAPT would be for students. Maybe we need a different version for them, but they've been using it for staff at the university, and they commented about neurodiverse staff and that they found the tool extremely helpful, as did neurodiverse staff, because they said that the staff commented that communicating is a challenge often for them. And so this really gave them something that was in a pattern. It was in a predictable pattern of questions. They could take it, they could self-assess, and they found it very empowering then to be able to use the tool to communicate, help them communicate for them, and that their HR and disability managers also found it helpful because now it focused a conversation on specific areas that could be addressed. So that's one example of the way that tool has been used. And again, I mean, I think there are lots of ways, but lots of different conditions. So we've had, again, the mental health where I don't know what to say. I just don't know what would be helpful here. So I'm sympathetic, but this really gives people something to get their teeth into. So we've heard that around some of the common mental health conditions as well. Still, again, getting over that barrier of sharing is disclosing is something, but to be able to say, I don't want to go into details, but this is a particular challenge I'm having for personal reasons, often starts a conversation, and it then people aren't being forced to disclose as much as they were concerned about. We've also heard, and I'll stop, about the work conditions. We've really tried to take into account that we know work is changing. There's a lot of hybrid things, or there's like this, hot desking and hoteling. And that's really hard for some people, as you would know, with limitations, that I need to be in a quiet place, or I don't want to be around someone who smells of cigarette smoke or whatever. So we've also got a lot of things we've been thinking about there that's been useful.
Okay. Another question, does the tool provide supports for learning disabilities, for instance, dyslexia or reading comprehension issues?
I would say no, in the sense that there are certainly in the organizational version, for example, suggestions that supervisors and others look into training needs and other resources that exist to deal with whatever the challenges are related. And this would probably be a lot of in the thinking, cognitive tasks at work, but it doesn't link to any specific resources. It raises a good point. In providing some suggestions, we have stayed away from advertising for an organization. We don't recommend specific types of chairs or, lifts or things like that. However, if there are publicly available sites that have good evidence and things, we will be trying to have an other resources page that links people to, not so much on the JDAPT, but on the website, that links people to legislation or places they can go to find information. So would be happy to take in some of that if you have some of those things. So we're not averse to kind of giving some specifics, but don't want to necessarily get down to the nitty-gritty.
Okay. And it looks like that is it. Plus, we're getting close to time. Thank you so much. Your work in this field, and in particular these tools, is so valuable. I'd also like to remind everybody again of the September 30th certification renewal deadline. And as mentioned, you will get one CEC for attending the webinar. If you have any questions related to the renewal, please check the CSPDM website and contact info@cspdm.ca. So thank you very much, Monique. It was a pleasure listening to your presentation today, and I wish everyone a good day.
And thank you for all the kind comments. Have a great day. Take care.
Thanks.
Bye-bye.
Bye.